My name is Ivy Chimulwa. I'm a former student from Makerere University, Kampala, Uganda, in Africa. I did my project on the antibiotic and antibacteriophage susceptibility of diarrhoeic E. coli isolates that I got from a local hospital called Mulago Hospital. And majorly as to why I did this was a project I did for my undergraduate. So the reason as to why I did this was our country was facing a lot of childhood deaths with diarrhea, and this was because the different drugs that are being used to treat diarrhea are not working. So I decided to come up with this project, and basically, let me just start it off. We are aware that antimicrobial resistance is a threat to global health, and different strains of pathogenic bacteria are getting this antimicrobial resistance. And I decided to specifically concentrate on E. coli and the four different types that cause human enteric disease, which is enteropathogenic, enterotoxigenic, enteroinvasive, and hemorrhagic E. coli. So in my country, the only form of treatment for diarrhea was the usual oral rehydration salts or drugs. However, I think we can go on. However, can we go on? There was no other alternative to treating diarrhea, hence the utilization of bacteriophages, which are a new science in my country. It has not been done before. I'm trying to go on, but can't. Can I get some help?
Just hit your arrow keys.
Okay, okay, great. So there's a global 2.7 billion cases of diarrhea diseases in children and 1.5 million deaths of diarrheal disease in children. And the UNICEF in 2009 stated that the coverage of the treatment for diarrheal disease was the lowest in sub-Saharan Africa, where Uganda was just found with 39% of the population receiving treatment for diarrhea. And more than 57% of the people in most parts of Uganda were seeking treatment for diarrhea, yet the people who are receiving the treatment for ORS were just 37%, which did not make any sense. They did not know which other alternative was there to treat diarrhea. So, and also an additional source was the oral rehydration salts also were a major setback because of the poor sanitation practices that are in the different homes, which leads to even more introduction of these pathogens during preparation. So we were basically just trying to treat something, but introducing another pathogen or something worse while treating E. coli diarrhea, which led me to study the antibiogram of the different diarrhoeic E. coli isolates. And then I isolated and partially characterized the bacteriophages that I isolated against them. So how I began my project was I went to Mulago Hospital lab because most of the people who were suffering from this disease were visiting that hospital. So I went to their lab, and luckily enough, they had been isolating the different E. coli isolates that were coming from these patients. And I got about 30 of them. I determined their antibiotic susceptibility pattern using the Kirby-Bauer method. And after I looked for bacteriophages in different sewage effluents, I went to the main sewage effluent in Kampala. However, when I tried to look for phages from that sewage effluent, I did not get any. So I decided to go to the source itself, which was Mulago Hospital, and look for bacteriophages there. And I was lucky enough to get some. And I isolated these phages by both direct and pre-enriched phage treatments using the spot test assay, and purified them using the plaque method. And due to time and resource constraint, all I did was just the host range, the efficiency analyzers, and a few stability tests. So from my project, due to time constraints, because this was a final year project, I didn't have that much time and I didn't have that many resources because it was self-funded. I isolated 5 phages specific to the E. coli, which were coded P1A, P1B, P2, and P3. I picked out just 3 of the phages because they are the ones which exhibited the most activity against the 30 E. coli isolates that I had gotten. And I also registered an average efficacy of plating of about 0.003 in the first phage, which was P1A, then 0.0004 in the second phage, and 0.0002 in the third, which was phage P4. And after reading a few articles, I found out that the average EOP value for a phage bacterium combination was classified efficient when productive infection resulted in an EOP of 0.001 or more. So I also, due to time, I also decided to just pick out the best, which was P1A and P4. They registered the desirable characteristics for therapy. So I went ahead to do their stability tests, and we could see some of those here. Phage, I really like Phage P4 because it had really high titers when we were doing the multiplicity of infection test. And when we got to the stability test, you could see that Phage P4 had a good stability in slightly acidic and also still almost maintained the same stability as the pH kept on increasing. However, once it got to a very alkaline pH, the numbers reduced a little bit. And when we got to the temperature bit, the Phage P4 still exhibited good characteristics. It was stable at sub-zero temperatures until high temperatures. Once we got to 60 degrees, the titers fell to 0. And what I really liked about when we did the same studies on Phage P1A, it had varying characteristics at different varying temperatures and pH. But what I liked about it was that it kept its titer when we increased the alkalinity of the solution, which was something that I registered as would be beneficial once we do more work on these phages. So what I recommended, what I missed doing from this project was I did not evaluate the combined inhibitory effect of the isolated phages to see whether they could be used in a cocktail formulation. And also, unfortunately, I did not do any molecular characterization of both the bacteria and the phages to evaluate any possibilities of any undesirable characteristics. And if you could take a look at just here, you could see that there's some bacteria that still were resistant to the phage infection. So this is where I am basically going to put more effort in as soon as I start my master's degree. Hopefully, I want to continue with this work and ensure that I get all that work done, because phage science in my country is still something new. It's still something that scientists are learning, and I hope to use that information to help build more on what we can do. Thank you. Any questions will be, I guess, taken in the chat.